All right, we're going to talk about statins for a minute. Statins, the basic name for something called an HMG-CoA reductase inhibitor. All right, statins is a much easier way to say this. But basically, an HMG-CoA reductase inhibitor, HMG-CoA reductase is an enzyme produced in the liver that contributes to the production of cholesterol. So if we inhibit this enzyme, then we're going to get lower cholesterol in the blood. Why am I saying this? It's because statins, this particular type of medication, the inhibitor, also inhibits a very, very important enzyme called CoQ10. So there isn't an argument that statins help lower cholesterol. However, I think it's malpractice for a doctor to recommend and prescribe statins without telling somebody they should also be taking CoQ10. I'm not a fan of statins in general, but I'm not here to tell you to take them or not take them. That's a conversation for you to have with your doctor based on a lot of research that you should be doing. However, it is factual that this particular type of medication will reduce CoQ10. CoQ10 is vitally necessary for muscle function in your body. So this is why when lots of people, depending on their genetic makeup, when they take statins, they find out they hurt. They have joint pain, their muscles ache, things like this. Now they're trying to make better statin drugs to slow that process down or keep that from happening. But understand it is going to happen because we're inhibiting this enzyme called CoQ10, and CoQ10 is needed for your muscles. Interestingly enough, your heart is a muscle, and you need CoQ10 for your heart. So if you're going to be taking statin medications, you should also consider taking CoQ10 to help the health of your muscles. All right? So just a short little public service announcement, if you will, that if you're taking a statin medication, you should also be taking CoQ10. All right? You can get it in the form of a supplement because your body's supposed to be making it on its own. Your liver's supposed to be making it. However, when you're taking a statin drug, you're going to lower CoQ10. CoQ10 is vitally necessary for a lot of other metabolic processes in the body. However, it is vitally necessary for the function of your muscles. Therefore, if you're trying to take a statin drug for your heart health and heart disease, and you're not taking CoQ10, obviously you're impacting one thing potentially, helping one problem related to heart disease, which is your cholesterol levels. Again, I disagree with that, but let's go with that for a minute. Then creating another problem related to heart disease, which is lowering CoQ10, which impacts the health of your muscles, including the muscle of your heart. Anyway, I hope you found this helpful. I'm Dr. Dave Morris at Magnolia Medical Center here in Murfreesboro, Tennessee. I hope you have a fantastic day.